Welcome to Delta, the podcast that dives into the heart of healthcare innovation. Each episode, we bring you insightful conversations with people who are at the forefront of the industry, researchers, policymakers, and startup founders. Join us as we explore the challenges, triumphs, and breakthroughs that are driving a significant change or a delta in the healthcare system. Today's episode is brought to you by Supportful. Are you looking to grow your team and hire engineers? Look no further. Supportful is a company specializing in connecting you with the right people with the right skills. Whether you are building a web application or a mobile app, Supportful can help. They specialize in offering high-quality remote talent and have established successful partnerships with companies in the US, Europe, and Singapore. Additionally, Supportful addresses the brain drain in Lebanon, aiming to retain young, skilled professionals in the country by promoting remote work opportunities. Physicians spend quite some time of their training in residency or fellowship, which are considered the busiest years of their life. However, managing their schedule efficiently can be a logistic nightmare. Ensuring that residents are assigned to the right night shift, taking into account their preferences, clinical requirements, and the need for fair distribution, it's not just a matter of convenience, it's a matter of patient care and resident well-being. Furthermore, in many programs, resident scheduling is one of the administrative tasks of chief residents, which could add up to their clinical duties, another task that has no benefit for their own professional growth. This is where MeshAI steps in. Dr. Yousefi and his team have recognized the critical importance of streamlined resident scheduling in healthcare institutions. MeshAI groundbreaking platform is designed to alleviate the burdens associated with this process, reducing staff scheduling time by a remarkable 80% and eliminating the pain and the frustration that often accompany scheduling challenges. By optimizing schedules with mathematical precision, MeshAI ensures that residents can focus on what truly matters, delivering high-quality patient care and advancing medical knowledge. Today, we explore how MeshAI transformative technology is not only revolutionizing healthcare staff scheduling, but also enhancing the overall healthcare experience for both residents and patients. And our host today is the CEO of MeshAI, Dr. Yousefi. All right, then welcome again. Thank you so much for being here today.
It's a pleasure, Ruben. An absolute pleasure to speak with you today about our journey.
I'm very excited to have you. It really touched upon one of the most important things that I experienced during residency, which we're going to talk about more in details. But without further ado, I want to hear from you. So can you provide our listeners and provide me with an introduction to MeshAI? How did the journey of MeshAI begin? And what inspired you to start this platform?
Thanks, Ruben. I think that's a very good question. I'd love to start there because that's really the core of our why. I'm a faculty member in Canada. I've been a professor at Queen's for about 20 years and not from within healthcare. My area of research is algorithms. I work on mathematical aspects of telecom. That's what I did until a number of years ago, where I had a near fatal incident in healthcare. So today, nothing that I hide from people anymore. I'm dealing with DVT, deep vein thrombosis. I'm prone to blood clots. So we discovered that back in the day. And essentially, my near fatal story has to do with fatigue, which has to do with errors on scheduling with spreadsheet, manual scheduling of a staff. So like many things in life, Rupen, sometimes you need an impetus, sometimes an incident, an accident, randomness to begin something, but it takes a lot more than that to go for another 10 years, right, to continue. So for us, that was really the starting point. And very soon I started reading and learning about healthcare. And then the data that I collected, what I learned through that journey is the thing that keeps me and the team going forward. It's no longer personal anymore. This is about really what we've learned in healthcare as we think the number one challenge of healthcare today. So that's our story.
Yeah, I can't agree more. I think one of the common themes that I've noticed around lots of founders in the health tech space is having a personal story. Someone from the family experienced an issue or a problem or a disease or a pathology, and that's what triggered them. And I think that's what healthcare needs. Healthcare needs doers, people who see a problem and work on it. I want to deep dive more into the name of MeshAI. It suggests collaboration between AI, or the name suggests collaboration between AI and systems. Can you tell me more about the significance and inspiration behind the name?
Absolutely. It's sort of a double meaning. MESH is the four acronyms of four scientists and engineers, co-founders of the company, where this began as an experiment or activity at Queen's University almost a decade ago. So that's that. But the second part of that has to do with what we wanted to do is that with our initial studying of the problem, going deeper in clinician scheduling at the time, to understand why the thing that had happened to me had happened, and understand what's really the state of healthcare clinician scheduling or staff scheduling. We learned that there's a big disconnect, Rupen, between the frontline workers and the management and the leadership. That could be a residency program, potential disconnect between the program director, program administrators, and the residents, and possibly the chiefs. And then you go higher level, at a level of a healthcare network hospital, again, a disconnect between the leadership, the C-suite, and physicians and nurses and fellows and residents that are actually running the system, dealing with patients on a daily basis. So the idea of MeshAI is really the idea of meshing all of these people, these stakeholders, key players of healthcare systems together. The leadership matter, as we all know, significantly. They set the culture, the direction for the entire organization, but the actual time spent with with patients is really what our physicians and nurses and fellows and residents are doing. So we wanted to really mesh all of that together, and this is really the thing that led later on to us really creating a new category in clinician scheduling called collaborative scheduling. The idea is having everybody on the same page or on the same network.
Gotcha. Let's say I'm a program director and I heard about MeshAI. Can you explain to me in simple terms, what is MeshAI, what does it do, and how can I implement it in my program?
Very, very simple, Rupen. When we were doing our conversations at the beginning about scheduling, a couple of things we learned. First of all, scheduling is probably the most non-standard thing, and not patient scheduling, not OR rooms scheduling, equipment scheduling, clinician scheduling, provider scheduling, is in fact the most non-standard thing that happens in healthcare today in Canada and the US. You could go to a hospital and two units side by side that are very, very similar to each other, can have nothing in common when it comes to scheduling of their staff. It's completely something that is left to groups to decide locally. They even choose their own software and methodology, and that's why you go to a hospital, medium-sized hospital, and you have 20 different scheduling products being used at the same time. So you can think about all the challenges there. So we learned through the conversations there that you need to have a system that has three foundations. One, it asks clinicians what they need. That's foundational. Healthcare is human-centric, and we have to start by taking care of our own humans, our providers. So ask them what they need. The second part of that is now that we figured that out, you're probably looking at a very, very challenging scheduling problem. If there are, leadership in healthcare sitting listening to this, they're probably thinking, oh my God, I have a hard time managing the vacation requests. How can I ask them whatever they want? And this is the whole thing. We believe that you can have the cake and eat it too. And I can talk about that later. The second part is having a powerful engine, mathematical algorithm that can grab all of that for any size team and then generate the schedules that are fair, transparent, and compliant, that meet the requirements of residency program, payroll, ACGME, wherever the location might be, and also local continuity of care, clinical needs of that unit. It's a very, very tough mathematical problem. That's our moat, really, one of our competitive advantages, that we have had 20 years of research in a different but similar area of algorithms that we brought into this space. And the third part of that is that life doesn't happen on a schedule. You generate a schedule, you push it out. Things happen, from the pandemics to accidents, COVID positivity, where you need to cancel last minute or even weeks before because of a conference. You need to pull somebody out, pull somebody back in there. How can you do that again to keep, as you maintain fairness, transparency, and compliance? So that's the third component. So MeshAI is really a system that is giving these three modules, if I may, to people in healthcare in a very customizable fashion.
Yeah, I just want to add one thing here. People underestimate scheduling until they are in residency. No one knows as a resident, like one extra, I emphasize that, one extra call shift per month, it will make or break your month, literally, because like it will affect your sleep. So I can share my experience. So lots of programs when it comes to scheduling their residents and people who work there, it's just like an Excel sheet. We bring a couple of humans, whether they are chiefs of the program or whether they are administrative people. We pay them like $40,000, $50,000, $60,000, and we ask them to schedule different residents on different call schedule. And eventually, who is doing this in the current state is a human being who's prone to mistakes, who is prone to error, and cannot remember how many calls X individual or Y individual has already done during the past 6 months, or what X individual has done in the last month. If I'm a resident who is working in an ICU rotation, which is intensive care unit, which is very, very hard rotation, and then I switch to internal medicine rotation, and let's say I have the 2 last weekends I'm working on the intensive care unit, and the first 2 weekends, for those who don't know, residents work 2 weekends out of 4 weekends. That's what we do in medicine. So if I'm working the last 2 weekends in critical care and the first 2 weekends in internal medicine rotation, and this rotation is back to back, so I will have a full month working non-stop without even a day off. And that's brutal. I've been through that. I had weekends where I worked 3 weekends back to back. And it's very hard. Like, you need a system to schedule people in a fair way. And you need a system also. You brought up the point of COVID. And I don't think we are immune from another hopefully it doesn't happen, but in case things happen in the future, hopefully not COVID again, but like, you need to have a system in place where we can schedule different people into different rotation in a fair way, respecting human nature, which is something we forget when once we are in the healthcare. We just like assume that as physician, we don't stop. We work, we bring work home, and we just continue. Anyways, so as the CEO of MeshAI, what is your vision for the platforms of future? Are there any specific areas within healthcare that you see that MeshAI is making a significant difference in the future?
Absolutely. So for us, it really comes down through our initial studies and really 5 years of being in the market with the product that you see today as a SaaS solution or cloud solution. It comes to really 5 areas. If you want to do call scheduling really well, we're known right now from coast to coast in Canada and US as a call scheduler that provides what we call STARS, really STARS scheduling, collaborative scheduling. The S, the first S is really square, the fairness, and a fairness that is transparent. That's the T that comes after. So we truly believe that, you know, fairness doesn't really matter unless everybody sees it, right? If you have the people on ones and twos, right, Rupen, that believe their schedule, the calls are not really fair, then it really doesn't matter. It doesn't have the impact that you would hope to get through your investment into a platform where you can get rid of the friction, animosity that might exist among staff. In fact, we have data that shows when MeshAI launches, we improve relationship among colleagues, be it a residency program, a physician group, or the entire hospital, hospitalized staff that migrate to MeshAI. So the other one's adaptable, really making sure that, because as I just said a few minutes ago, and Rupen, I'm sure you've seen this, that is scheduling, even when you do your rotations at residents, you go from program to program or specialty to specialty, things are done differently, right? The rules, accreditation rules might be different, but, the program directors, administrators, and chiefs make decisions, when you look at the history, legacy of that group, that really determine the future of a scheduling and make it different from other units, make it unique. So we need systems that are adaptable And as a result, you can manage various workflows. Again, I should say MeshAI is quite unique in terms of how adaptable it is to give you the workflow that you have, rather than having you to change your scheduling right now. And the RNS at the end of a stars is really reputable and seamless. We are really known as a product that is going to be behind you as a partner. We typically don't think of ourselves, and it sounds like marketing, but I really emphasize this aspect that we don't want to be a vendor. We would like to be a partner in scheduling. And this is really the way the entire clinician success team at MeshAI is structured. We're there to support, no matter what it takes. And in one of the things that team measures, our clinician success team measures, is that as we go through exact customization and setup of MeshAI for any team that is unique, as we just covered, that we do that with minimal involvement from people like yourselves, Rupen, and PDs and PAs and the C-suite directors, who are typically physicians, very valuable, stretched, super thin staff in healthcare. We would like to make sure that this is done with minimum number of minutes of their time. And we've spent quite a bit of time in the past 6-7 years devising, inventing technology and processes that minimize the involvement. So we go from a demo, if this were a demo of MeshAI, to a full launch in 3 to 4 weeks. I think the fact that we can afford that, it really is a testament to the significance of this for us over the years and how we do that. So the way we see the future, Rupen, is that really being able to provide a 360 solution. We don't want to move into any other area. We're going to be focused on healthcare. Every so often, Rupen, I have to cancel, the team has to cancel a demo coming from outside healthcare. Unfortunately, we can't, even though the problem is the same problem. No matter if you're looking at a restaurant or manufacturing, we don't do that. We're really committed to healthcare and to our clinicians. And we would like to grow vertically to be the solution when it comes to calls, ORs, clinics. And as we speak right now, also we're building block scheduling components to automate that top level residency program scheduling that is primarily done by hand as well, from coast to coast. So that's really where we want to be in the future.
That's so sweet. I just also want to add my input about one point, that MeshAI showed that it improved relationships between like residents or coworkers, which is very important. Again, I'm explaining this for people who don't know. Usually the person who schedules residents or physician, usually they are not that likable person, because like as a resident, when you are scheduled on a different calls or 5 or 6 calls, you're going to always, oh, why did he schedule me on 5 calls? Why did he schedule me on 6 calls? Why this resident have X amount of calls? Why I have Y amount of calls? And that's where we need an AI solution. We need a solution to make this scheduling and a machine problem, not a human problem. And as a human beings, when you go to a training program, or we go to a hospital to learn, or to go to university or medical school, we're going there to learn how to interact with patients, and we are learning how to treat diseases. There are some administrative things that we have to tackle. There are some research things that we have to learn. But I don't think that learning how to schedule people, putting them on an Excel sheet, would bring any value to physicians' learning career.
Makes sense. Makes sense. And it's so sad. It's such a hard work, Rupen. And then these people are not appreciated. And generally speaking, judged and accused of favoritism and things like that, while they're doing their best to do a very, very challenging work by hand.
I know. I remember, like I talked to, I heard from many of my friends, that was one of the reasons that I didn't become a chief, because I didn't want to do scheduling. Well, I heard from one of the chiefs, my friends, not in my program, a different program, that they would get random messages from people on a different rotation, resident on different rotation. Why did you schedule me this amount of call? Why did you schedule me that amount of call? So it's very emotional and intense, and you never know unless you are doing it.
That makes sense. That makes sense.
All right. So I want to dive a bit about your background and your strategies on team building. You have a background in healthcare, you have a PhD, I mean, you have a PhD, you have a background in science, and you have a background in electrical engineering and academia. How has your academic experience influenced your approach to entrepreneurship? You had a stable job. Why did you do this? And why did you develop MeshAI? And how has been the transition from stable academic job to the lifestyle of entrepreneurship?
Rupen, it's a very good question. As you mentioned, I am an outsider from healthcare, and one of the things I learned very early on is that the challenge with healthcare, the fact that there is no shortage of innovation, but there is resistance to adopting innovation in certain areas, is something that is completely understandable. People can go and talk about healthcare and say, people in healthcare are still using a fax machine, or they're resistant to change. But if you actually put yourself in their place, these are people that are playing with people's lives. Like, there's what else? What more important thing can you imagine? Like, profession on the planet, honorable and more challenging than playing with your loved ones' lives, with your own life. So this is important. So the fact that people in healthcare are very careful in adopting technology completely made sense to me. So I don't come from that angle at all. So one of the things I had to learn is that if I want to do this, I don't want to be another engineer building a product and shoving it down and then expecting people to adopt and come to it. You build it and they come. That's not the case, as we know, in entrepreneurship, and it's particularly not the case in healthcare. So that's why, from early on, I realized that I have to educate myself about healthcare. That started by reading as I was bedridden, dealing with my medical condition. My bedtime stories were all in healthcare, from strategy and policy in Canada, why healthcare, the universal healthcare system in Canada is the way it is today, all the way to systems like the one in UK, Scandinavian countries, and other places that have better performance overall. And so I had to learn it. But the parts that really helped me get there quickly was the fact that as an academic for the past 20 years, I always say to people, if you are coming from a research-intensive university and you've been doing grant applications, you're basically an entrepreneur, because there are great parallels. For every grant application, you find a problem. The problem has to be big enough. You got to get grants, write the grant, get a bunch of people excited to give you the money. Then you have to hire, you have to equip your lab, then you got to build and deliver. Now, having said that, you deliver papers, it doesn't have to lead necessarily to a product, and that changes the game quite substantially. But the process overall is not that different. So I think a lot of academics are serial entrepreneurs, and they don't even know that. You just have to change your objective, right? Your cost function is different. You got to make sure there's a product and people pay for it. There's got to be product market channel fit at some point that you might not need as much for a 5-year grant from NSERC or CIHR. But so those things really helped me, but I really had to make sure that I complement myself with the other stuff specifically for healthcare. And the other thing so those are all the good things, positive things that help. The one that doesn't help is that we as academics, and I think you understand it because you do a substantial amount of research, Rupen, and you're doing clinical work. As academics, we're taught to be perfectionists, at least my era for the past 20 years. And that is the biggest killer of entrepreneurship. You just cannot be perfect. So you have to understand design imperfection, controlled imperfection, and then work through a series of iterations to get a product out, get feedback on it. And this is not only the product development aspect of it, but also the business development aspects, that they cannot be perfect. And you just have to work towards incremental improvement and lean methodologies and growth mindsets. So those are things that are now common. These are buzzwords that people talk about, but I had to learn those. And, those are some of the things that I keep talking about with people, with younger entrepreneurs, that if you're coming from academia, the one thing you got to get rid of is perfectionism.
Yeah, I can't agree more. I think we just, like, the simplest thing is writing a research paper. You cannot submit it. You can't tell people about the results until it's very, very, very perfect, no errors, nothing. And that doesn't work in entrepreneurship. And I think you brought up very simple and sweet analogy that all academics are serial entrepreneurs, but the product is different. Exactly. And I completely agree with that. You mentioned about hiring people to your, whether you are writing grants or whether you are developing a product. what strategies you look for when you hire team members? What advice would you give? Let's say there is an academic person right now listening to this podcast, and what advice would you tell him when they want to build a team to or hire people to develop a product?
Absolutely. That's an important and key area, because as you keep hearing from investors and possibly dusty entrepreneurs that are getting up to start the next big thing after a failure, is that the most important thing for success is your team, right? So I love the fact that you put your finger on it. So we have developed very, very good methodology, actually very systematic about hiring and who we work with. We call it the Agile Care. Is our own system. The word care connects to healthcare as well, which is really nice. And it comes to a bunch of things. We actually go out there and specifically and systematically use a scorecard for each individual hire that touches on adaptability and flexibility of that individual. That's the A of Agile Care. Then we go to growth mindset, integrity and honesty. They need to be lean operator and resourceful. That's, again, one of the requirements of any startup, especially for us, because we never raised and we grew this company with basically support, and our number one investors are our customers. So I'm really proud of that. Obviously, not for everybody, but I'm so proud that we could build and learn and grow with our customers. And then empathic communicator. Communication is so important for us. That qualifier, being an empathic communicator in interaction internally and externally with our clinicians. Being clinician focused and caring. We want to hire people that are really, really understanding. Our philosophy is that you got to start at home. We're here to take care of our clinicians. If you want to give tools to people in healthcare who really see value in providing better environment for staff, and they truly believe that it is with that you can achieve patient outcomes, reduce cost, improve access. So that's, again, something that we actually systematically check in people that we bring on board. Altruistic team player, extremely important. This is a boat. We're all in the same boat at MeshAI, and really important for everybody who joins us to understand that everybody's problem is everybody's problem, and being responsible and being effective. So Agile Care is the model that we've been adopting, and I really, really swear by it.
Oh, wow. Do you do that? Is there a type of questionnaire you make people who are applying to a job in your team to fill, or is it something that you try to ask about when you are doing the interview?
Thank you so much for asking. No, I'm not that smart, for sure. I had to learn it. I've made a ton of mistakes. In fact, my biggest mistakes are my initial hires with a company. And I'm not saying that being derogative or disrespectful. And not that these people were bad. They were not a good match, right? And this is my philosophy in life. There are no bad people. It's always a question of being at the right time and place, being a good complement to the rest of the team, right? So I think we started with a team that wasn't cohesive, wasn't complementary, and fantastic people, really strong candidates that could come and actually crush your team and take the entire ship down. So the methodology that we use comes from a book called Who. I don't know the rest of the tagline. WHO. The book is really focused on methodology tested for about 3-4 decades in hiring people in areas that you don't understand really well. For example, I'm not a front-end developer, but how do I go about hire front-end developers that are really the best at their job? It's a challenge for a lot of people. So the book gives you mechanisms and structures that are systematic and move you away from subjective decision-making to really objective decision-making that drive results. So that's the framework we adopted. But at the core of that methodology is something called a scorecard that you need to develop right off the bat before you start meeting the candidates. And so we've been very purposeful and careful about that Agile Care structure that we adopted.
Wow, very interesting. What do you think about using personality tests? Is that something that you use or you consider?
I think it can be very impactful and helpful, Rupen. There's so many good ones, from the Myers to a bunch of newer ones that people have used in business. We haven't used them, but I think it would really help. One of the things I can see is that after we find the person on the team that really meets those, 7, 8 criteria that we're looking for, a personality test would allow us to really understand how we can work more effectively together. Like if I know somebody is coming from the color blue or red of, this particular personality test, is going to really change my expectations in the response that I would get from them when I have something crazy or innovative versus something that is very rudimentary or basic. There's an analogy that's used by Kim Scott, the author of Radical Candor, in her book, where she says, there are people that are just not a good fit. You got to let them go. From the good people on your company, you got rock stars and superstars. So it's exactly that. So when it comes to understanding if somebody on the team who's delivering results is a rock star, superstar, which is then going to tell you in what direction you would move them, whether they grow vertically or horizontally in the company. Those are the things that I think can really benefit from personality tests, but I'm not very optimistic about using those tests at the entry level, or basically at your decision-making level for the hiring.
I hope you liked this episode. Stay around for more, because we are going to explore Dr. Yousefi's amazing journey into the health tech world in our next episode.